Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about Modifier 26. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. I have been a medical coder for over 10 years. I really love sharing the things that I know with all of you. So I hope you'll take a second, hit that subscribe button, hit that like button, and at the end of this video helps you, I hope that you will share it. So let's get started. Okay, Modifier 26, probably one of my most frequently requested videos for modifiers to get a further explanation. So I hope that my explanation today will help you. I'm going to leave the link to the article that I am referencing in today's video. This was a very good article, and like I said, I'll leave the link down there. If you have any questions, look on that link. You can also look in Appendix A of your CPT Professional Edition AMA manual, okay? Let's start off with the definition of what is Modifier 26. This is the professional component. Certain procedures are a combination of a physician or other qualified healthcare professional component and a technical component. Okay, when a physician or other qualified healthcare professional component is reported separately, the service may be identified by adding Modifier 26 to the usual procedure number. So let's break down, what does this mean? Professional and technical component. Professional component is talking about the provider. What are they doing? Their report, their interpretation. That is what professional component means. Technical component is referring to the technical side, like a technician that is administering this test, okay? Now there's different rules, but that's just to sort of get your mind to kind of get what each one of them means. Now there are other modifiers that refer to this. I think the TC modifier is another one, but I have to do that on a separate video because I don't want to put too much information about so many different modifiers on one video. I want to kind of concentrate on one and move on from there. So this really good article from carecloud.com, excellent at explaining the details of when to use Modifier 26 and when it is inappropriate to use Modifier 26. So I'm going to read from there what they have. So Modifier 26 can only be used on certain kinds of procedures, and certain kinds of procedures which include a professional component. Okay, now defining Modifier 26, a combination of a professional component and a technical component. Most often you will see this among diagnostic testing procedures such as ultrasounds or CT scans. When the professional component is one such procedure is performed separately, the specific service performed by the physician may be identified by adding Modifier 26. Okay, so professional component is outlined as a physician's service which may include supervision, interpretation, or a written report, sort of like what I said along those lines earlier, without having performed the test. Let me read that part again. So professional component is outlined as a physician's service which may include supervision, interpretation, or a written report without having performed the test. So the provider cannot have performed the test, okay? In short, Modifier 26, in its correct use, reports that a physician's service was to interpret the results of a test when they didn't personally perform it. Wondering when this type of scenario would occur? These clinical scenarios, okay, I'm going to read them to you. These are excellent examples from this article. So a sleep center performs a polysomnography. I always flub up that word. You guys can see the article, okay? For a patient. A physician is not associated with the sleep center facility, interprets the findings of the test. This physician would append Modifier 26 to 95811 to represent her interpretation of the polysomnography. If you don't know what 95811 is, it is polysomnography on a patient 6 years of age or older, sleep staging with 4 or more additional parameters of sleep with initiation of continuous positive airway pressure therapy or bilevel ventilation attended by a technologist. That's going to be your keyword right there for you to recognize. This procedure is done by a technologist. So the provider has to look at these results and give their own interpretation. So that is when you would be able to report 95811 with the 26 modifier, because this is going to signal that this provider did not physically do the test, but they're interpreting the results of this test, okay? Because it was done by a technologist, and they're the ones that's looking at this whole thing, and they're giving their interpretation of it, okay? So the next example is a pregnant patient presents to the ER with premature contractions. The ultrasound performed in the hospital detects abnormalities in the pregnancy. The patient is referred to a specialist for follow-up, and the hospital imaging report is sent with the patient for further review. The specialist reviews and interprets the ER ultrasound so that the specialist would be able to use modifier 26 on the ultrasound CPT to represent their interpretation only service of the report. Okay, so you see how that happened again? The specialist did not do the CT scan, but they did get the report, and they're able to do their own interpretation because they are a specialist. Okay, so that's another thing to consider. They did not perform it, but they have the imaging, and so they can do their own report. Okay. The next one is a treating physician orders a test from an outside laboratory for his patient. The lab's pathologist then provides their written report to the attending physician. In this case, the pathologist could bill the procedure 83020 with a modifier 26 representing their interpretation of the test. So the pathologist is a very important figure as well. So they have to be able to get paid for their interpretation. And in this case, it's saying that they are getting paid for their interpretation by stating that they're doing the professional side, okay? Obviously, the pathologist is not going to be the one that's spinning, right, the stuff. They're going to be interpreting what they see. So 83020 is a hemoglobin fractionation and quantination. I hope I said that right. Electrophoresis. That's what that procedure code is. So the treating physician orders a test from an outside laboratory for his patient. The lab's pathologist then provides their written interpretation to the attending physician. In this case, a pathologist could bill the procedure 83020 with the 26 modifier. So it is very delicate, but at least this way you guys can sort of understand how and why, all right? But the incorrect use of modifier 26, to illustrate the incorrect use, the treating physician in the above example could not bill 83020 with a 26 modifier themselves after they review the pathology report because the pathologist has already interpreted the test. The treating physician can include his or her own interpretation in their medical decision making, but they should not bill separately for it. So when it comes to evaluation and management levels, this is when all of this comes into play. This is saying that the pathologist has already done a report about what they see. The attending provider who sees this report can look at it. They can probably come to their own conclusion, right? But they can't bill for that 83020 with a 26 modifier. They can't do that because it's already been done by the pathologist. They can include their own interpretation of it in their medical decision making, right? That can be factored into their medical decision making, which can bump it up, okay? It'll bump up the level of risk. It'll bump up the level of complexity of the documentation that they had to review and things like that. So that is something you can keep in mind. When it's already interpreted, the provider cannot get it, okay? So it's a little weird, I know, but I'll keep going. So understanding, and it goes on to say, understanding the correct and appropriate use of modifier 26 will be key to filling out clean claims and avoiding denials for duplicate billing. Remember, the facility that performed the test must also file a claim for reimbursement of the technical component. This is why reporting modifier 26 on the same procedure code for the interpreting doctor will be critical in demonstrating your provider's specific role in the service performed. As such, reporting the modifier 26 correctly decreases your likelihood for incorrect payer denials and reduces in delayed payment, right? And it can be easy to become confused trying to keep the components of a procedure straight and remembering when modifier 26 should be applied. The helpful tip to keep in mind is this: if the provider does not own the technical equipment, they cannot bill for the technical component. Just like that polysomnography, right? The physician, it was at a separate sleep center, okay, and they don't own it, okay? In order to bill correctly, the use of modifier 26 conveys that the provider only performed the professional component of the procedure. So because in that polysomnography example, they did their own interpretation of the test, right, of the findings of the test, then that's when they would be able to append that modifier 26, okay, because it's a professional component of it. That technical component is the sleep center, right? They're the ones that are doing that. The provider is the one that's interpreting the results. There is no pathologist, right? It is solely the provider that is doing it. So I hope that makes sense. Does it make sense? I hope it does. Let me know in the comments below. Please feel free to comment if you have more specific questions about modifier 26. I know that it gets confusing. There's going to be times when you're not going to ever see some of these, the application of some of these modifiers. So don't panic. All right. You have to remember that there's going to be times when it's already been interpreted and all the provider is going to get is the medical decision making. It's going to be applied to all the components for their medical decision making for the evaluation and management. Yes, evaluation and management is going to change, but it never hurts to understand the basics and the fundamentals of why. You know, a lot of people are sort of rejoicing right now that, oh, it's going to be so much easier. It's going to be easier, but if you don't document right, if that provider does not document right, that's a lot, and that's a big mistake to make. So this is why it's always good to get knowledge on evaluation and management. And I know evaluation and management is scary. It's scary for a lot of people. I like it because I read the whole book and I've had a lot of practice with it. I've done a lot of professional service coding. So that's where all of my experience with evaluation and management comes into play. But you guys have to remember I'm 10 plus years in it. So that has a lot to do with it too. Because trust me, in the beginning I was just like, really? Wait a second. So, but yes, that's my show. So hopefully that clears it up for you guys, because like I said, sometimes you won't always see modifier 26 and you may not ever report it. So, but you may. So it's always good to have a good grasp of when to apply those different modifiers. So I'm going to wrap this one up. Thank you for joining me. I hope you've enjoyed it, and smash that like button. All right, if you're a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all next time. Bye.